third town hall meeting where we are going over our plans as we best know them today, based upon the current information and guidelines and the nature of the health crisis at this time, to the best of our knowledge. And we're happy to share these with you. This is the third town hall that we've had. We had our most recent one last night. There haven't been too many updates to what we shared last night, but we want to make sure we have another opportunity for you to ask questions as a community. I'll go ahead and introduce some of my colleagues who are on the video with us, or who are on the call with us. And I'll share my screen here just for a second so we can follow along with that. Joining us on the call today are Dr. Greg Stoll, the Assistant Superintendent for Pupil Personnel and Educational Services. We should have Ms. Deborah Legato as the Assistant Superintendent for Human Resources joining us as well, and Ms. Sandra Clohessy, the Assistant Superintendent for Business, joining us as well too. So they will be on the call and able to answer questions as if they pertain to that. So we will go ahead and move to the next part. Just a few logistical items and Zoom etiquette. This, as I mentioned before, this Zoom session is being recorded and streamed both to our YouTube channel, where it will be posted in the near future once we render it and process it. And then also we will be streaming to the cable channel as well. Your attendance in this meeting is consent that your video, your likeness, your actual image, your words and your video will be recorded. If you prefer not to be recorded, you do have the option of keeping your camera muted. Along those same lines, just so that everybody has an enjoyable experience in the meeting with the large number of participants we're expecting, if you would please make sure that you turn off your video and mute your microphone, so that way we can ensure that everybody has a comfortable viewing experience. When we get to the Q&A portion, we're turning off the chat because what we found over the past couple of months has been in large group gatherings, Zoom meetings, that we're only able to answer a few chat questions as we go through, and we don't want to miss any and have people think, well, they answered somebody's question but not mine. So we're going to spend a good amount of time hearing your questions and responding to your questions. So we will make sure that we have that there, but we have disabled the chat. It's not that we don't want you to be able to have the chat function. We don't want anybody to feel as if their question is not being answered. And if we don't get to all the questions today, because we know there are a lot out there, Dr. Stoll and I will share with you other avenues to have your questions answered, especially as we get to the oncoming welcome back to school dates that we have coming up. Just a reminder of the purpose of these sessions. We know how important the reopening of school is every year, especially this year in the middle of the health crisis. And we know that you have questions, or you know that you may have concerns, and we want to hear those. We also want to share with you our plan and our thinking as we best see it at this point in time. We want to also hear from you to make sure that we're keeping in mind everything that is going on within our community, to make sure we have the best possible approach going forward. And we will share our plan today with you about how we plan to safely open schools and also conduct the teaching and learning programs that we have going through our school system. So the brief agenda will be Dr. Greg Stoll will jump on after I'm done introducing and framing today's discussion. He'll talk about our safety and mitigation, our reopening safety and mitigation plan. And that word mitigation is key because we know with the nature of this health crisis that it is a highly communicable disease, highly contagious, and our best efforts when we start to have interaction and community interaction is to make sure that we take mitigation steps to stop or slow the spread of it. So Dr. Stoll will go through our best thinking of that right now. I will then provide an overview of our district learning plan to include things such as what are the various schedules look like if we're asked to go into different formats, expectations of students in those various formats, and then we'll open it up to your questions and we'll share with you our next steps. So without any further delay, I'm going to turn it over to Dr. Greg Stoll, who will provide us with before I get to Dr. Stoll, I just want to remind everybody that the information presented today is fluid, as we discussed. We must be able to adapt to changes in this virus's community spread, emerging mitigation strategies, evolving best practices, and guidance that we receive from regulatory agencies such as state and local health departments, the New York State Department of Education. So we're presenting you information as we best know it today. If it does change in the future, we will do our best to update update what we are presenting. Just two key individuals in terms of our response and plan for reopening. The district has appointed two positions. The COVID-19 safety officer, that is Dr. Greg Stoll. His role in this aspect of his duties is to ensure compliance within the district for making sure that we comply with our reopening plan as it is written and as it is updated. I serve as the COVID-19 resource officer. My role, I'm the point person for any questions you have about the COVID-19 health emergency and our district's implementation. I also coordinate as well as other colleagues throughout the district with the Department of Health on things such as guidance, contact tracing, those types of duties. And so now I'll turn it over to Dr. Greg Stoll, who will go through our reopening and mitigation plan.
Good afternoon, everybody. We have almost 170 folks on our call. We had close to 500 last night. Our previous town hall was well attended, and one of the things that tells me that this is a very connected community that is very engaged in their children's education and in their school community. And that is, in times like this is very comforting to know that our families are so connected and engaged in keeping us all safe. And that when we say keeping us all safe, that doesn't only mean children, it also means our staff, and it means each other and our families. So welcome this afternoon. I'm going to go through a little bit about just like a 30,000 foot view of the health and safety provisions of our reopening and mitigation plan. I'm going to talk to you a little bit. I'll start sharing my screen in a moment and show you where you can find everything. So I'm going to share my screen. Mr. Trombley is going to make sure that he can see it, so I know you all see it. All right, so the first thing I want to let everybody know is, where do you find all of this information and support information? And not just today, but as we go through our reopening of school. We have created, like we did during the pandemic in the spring, we created a different and new site where all of this information can be found. If you can get to our district homepage and you slide down under the superintendent section under quick links and click on the MSD reopening page, you will see a web page that we built that provides you with our latest communication, our videos, that also provides you with health and safety resources and support, such as contacts to the Department of Health, such as videos on how to wear a mask safely, how to practice proper hygiene. This is for you, your families, your students. There are also resources on parenting and school resources for parents and guardians while your kids are on distance learning. And we'll talk a little bit more today about how we're going to open, and we're opening in a hybrid model, which is approximately half the students in, half the students learning remotely, and then at a period of the week they switch, and the students that were home now come in for a period of the week. And Mr. Trombley will go through that more specifically later on. This is also where you can click on get a parent-student technology help desk ticket. So if something's not working with your child's Chromebook, you have connectivity issues, this is where you get all that information. But we're going to focus now on our district plan. I'm going to kind of unpack it with you, just in terms of broad brushstrokes. So we have our district plan both in English and in Spanish. If you click on the district plan, up it will come. It is approximately 60 pages. Remember, this is a fluid document that has been built over time with guidance from New York State, from the Centers for Disease Control, from the Department of Health, as well as any executive orders that have been shared with us from the governor's office. So let me talk to you a little bit about how this plan is built. There are certain guiding principles that this plan is built upon, and they include health and safety, how we keep everybody safe and well, and what mitigation strategies we have in place. How do we take care of our facilities during a pandemic? How do we make sure our kids are fed? How will we transport our students? What are the social emotional needs of our staff and our students? We have been out of school since March, and also not having that connection to school in the way we used to, having the uncertainty of opening schools when there's still a pandemic in this nation, has to have a social emotional impact on all of us. The other things is how our school schedule is going to work, and Mr. Trombley will go through that. We know that all of these extra provisions of cleaning and supports are going to have a fiscal and budget impact, and we won't talk much about that because this is really about the safety and wellness, but we have to take into consideration and plan for those things. We're going to talk about attendance. Attendance is critical. When Mr. Trombley talks about our learning plan, it's going to look different than it did in the spring, and there's going to be more checkpoints for students ensuring that they are attending school. And I apologize if you hear banging behind me. We are having, we'll be glad to know that our roofing project is going well here at the Falls. And so if you hear something bang or see something fall behind me, nothing is wrong. They're just completing the roofing project. So I apologize. Also, Mr. Trombley will talk about teaching and learning, and we'll talk a little bit about the impacts for special education and students who are second language or world language learners and how equity has to come into account with that. We know that, and you'll see in some of these, some of our mitigation techniques, you'll see that that may have an impact on how we staff our facilities and what our staff needs to do and students need to do if they have an underlying medical condition. So we're going to go through all of those things. And later on in the plan, all of those considerations are broken down about exactly what are we doing by location. And I'll talk a little bit about, and what we tried to do is think about every location that our staff and our students are, and how do we take those guiding principles and apply them to those locations in detail. So I'll give you one example. I can't go through everything today, or we would be on this call probably today and well into this evening, but I'm going to just unpack some of the salient points. So I need to thank all of the folks that along the way, since we started planning this thing way back in April, that have been part of the discussion. All of our stakeholders, many of you participated in learning surveys. We've had town hall meetings. We've had our district-wide safety and health advisory councils talk about it. Our partners at BOCES, our Department of Health, our nurses, our teaching assistants association, our teachers association, USWAM, UPSU, all of those unions who we've had some discussions about on how do we do this safely. So moving forward, getting into our guiding principles, I think there's a few things that I think are salient for me to share with you today. Number one, first and foremost, is we are going to be rolling out an application or an app very shortly where all students and all staff are required to complete a health screening check prior to getting to the bus stop or prior to coming into our school building. And it's going to ask a series of questions. One is if you have a temperature over 100 degrees or greater, any of the COVID-19 symptoms, or any of the COVID-19 questions about being required to self-isolate or been in contact with someone with COVID-19 or been diagnosed with COVID-19. So those questions need to be answered daily. And again, that's prior to your child getting to the school bus stop or prior to you as an employee coming to work. And if you answer yes to any of those questions, we're not collecting that data. We're not knowing which of the ones you answered yes to. It is going to ask you to either report your absence, your child's absence, or your particular absence using the reporting procedures. And if you're a staff member, it's going to tell you to talk to your supervisor. So those are the things that are going to be very different for all of us, all the way from central office to our students, that we all have a part to play in this. It is a requirement from New York State that we participate in health screenings prior to entering the building. We have procedures for returning to work after an illness. We're going to ask everybody the days of being one of those warriors with tissue in hand and feeling a little sick and coming in anyway and bearing through it as an employee or bearing through it as a student, those days are going to be behind us. If you don't feel well, you're running a fever, you have any of those symptoms, please do everybody a favor, stay home. And that means running a fever. That means unmedicated fever, meaning that if you had a fever and you medicate, you stay home. Even if with medication your fever has subsided, you need to be 24 hours free of a fever without fever reducing medications. The issue that's going to have for families, even for staff, if you come in, you answer no because you're on medication, you come in and your child runs a fever later on, your child will be put in a room that we're going to need to isolate people, and this is part of New York State requirement, and you will be sent home. So please, the best thing you can do if your child's not feeling well, and don't send them to school. If they're feeling well enough to participate, and when we get into what the remote learning is, even if it's a day that they're supposed to be in, they still may be able, if they feel well enough, to participate remotely that day. This is going to help our healthcare staff. This is going to help you as a parent. Please don't send your students in not feeling well. It's better that they stay home, and if they feel well enough to participate in instruction, there's a method to do that, and we'll go into that. Again, I talked to you a little bit about that website. Has a lot of resources if you want to know more about COVID, the symptoms, and about mitigation strategies such as mask hygiene and those sorts of things. That's there as well. We do know that there will be some staff and some students that have underlying medical conditions that make them a higher risk group. We have provided for our staff, also available on our website, if they need a medical accommodation, which may be something as simple as additional PPE to other accommodations, we have a form for that. Mr. Trombley will be sending out a survey at the end of, and he'll talk a little bit about it later. He'll be sending out a survey amongst other things that it asks of whether your child has a medical condition that will require them to have a mask exemption or any other medical condition that would require them to be in full remote learning. We will also talk about parents having the option with a medical condition or just highly concerned to elect to participate in full remote learning, and that survey will include that as well. The other part of what we're doing, which is a little bit, had to be spelled out a little bit more, but was in our plan, and we'll be updating this, is our testing and contact tracing requirements as a school district. We've been working closely with the Department of Health. We are not a testing site. We are not a testing facility. We cannot do that. So I know that there was some discussion out there on the news about Governor Cuomo and his discussion about schools having to test. And what he is saying is we don't necessarily have to test. We don't necessarily have to test. We just have to make sure that we have procedures where we're working with the Department of Health and assisting them in them doing the contact tracing and providing families with resources if they think they need a test, where they can go possibly to get that. So that is there as well. Some of the things that are really important, I think, has been everybody's mind, whether you're a staff member, whether you're a student, are disinfecting procedures. We have looked very hard at each location and made sure that every building, every night, is going to be disinfected. Every location in a building, every school bus is going to be disinfected nightly with an agent, a cleaning agent that has a kill factor, that's what they call it, for COVID-19. That's been approved to use for COVID-19. That will happen every night in every building, in every school bus. During the day, there will be frequently touched areas such as bathrooms, doorknobs, handle rails. We will have custodial staff walking around trying to clean high touch areas as much as possible throughout the school day. And in each classroom, we will have, in each location and bathroom, we will have the dates and times in which those locations have been cleaned. So just know that, and there's enhanced cleaning procedures in such locations as our health office, where we may typically in a given school day have students who may be ill. And we are going to have a wellness office and another office for students who are not feeling well and have have fever or have symptoms of being sick, rather than having them come into a location where kids are just coming for a wellness check or coming for a Band-Aid or coming for any medication that they may be provided through the health office. We're going to continue with our safety drills with modifications, keeping physical distancing. As you have seen from our superintendent, we have an ongoing communication system. Multiple times a week, we're communicating with you. This is a very fluid situation with a lot of considerations, and it's critical that we give you information and that we post that information on our new website where you can easily access them. The other thing is there's been a lot of discussions about like school closures in the future, and we're not talking about a snow day, and we're not talking about inclement weather, or as we had, unfortunately, a tropical storm with power outages. We're talking about school closures due to any COVID-19 issue. I will say this, we will work closely with the Department of Health. They will advise us on the best practices. And it may not necessarily mean a whole district. It may not necessarily mean a whole building. It may not necessarily mean an entire classroom, but they will direct us on the proper isolation that we need to do. We will communicate that we need to close part or in whole, but we can't tell, because there are privacy laws, we can't tell you who or in what class there has been. Department of Health will contact those people who may have been exposed, and that is part of their responsibility for contact tracing. Facilities, just in I'm sure there'll be some more questions during our questions and answers. I think it's really important that we still have to adhere to all building codes. We have to ensure that we have to reduce the amount of students that are in our building. And the reason that we're going to go into a hybrid mode, meaning partial students in, partial students remote, and at some point flip, is our physical footprint is not big enough for in our hallways and in our classrooms to have everybody in and be able to keep a social distance or a physical distance that's well within the CDC guidelines. It's just not physically possible for us to do it. We thought about it. We wanted to bring all our kids in, but we know according to the guidance documents and according to best practices in health and safety, we couldn't do it and have 4,000 kids in our buildings and not have our hallways cluttered, our buses cluttered, and our classrooms cluttered. We wouldn't be able to provide that. So that's really important. We are making sure that we are looking at all our ventilation systems and ensuring that we're changing our filters, because there's less students in our buildings as well. The airflow is more because you have less students in terms of fresh air. So that's something that I think is important for us all to know. Again, our food, our nutrition for our school food authorities, our FSA program, students will be, either bringing their lunch or getting their lunch, and depending on the location, we are going to make sure we reduce the density of where kids eat. Those kids that are on remote learning for a portion of the day and are entitled to food services, we're going to make sure that they have food as well, and that'll be communicated through your building. So, and we're going to make sure that we have enhanced safety procedures on the making of food and the delivery of food as well. Transportation, this is really important. All students are required to wear a mask, and we are going to the greatest extent practicable, separate kids as far as we can. The other thing is that we know that there may be students that need a medical exemption because of a mask. Those kids will be on the bus. Our students will load the bus from the back to the front. So if you're the first stop, you're getting on in the back. And then when we disembark, the bus driver will make sure that the first row goes first and that there's a space between the second row, the third row, so that we're equally spacing. We're also making sure that we have students enter our buildings, not in one location, but multiple locations when they come off the bus, so that we're reducing the density of students in our hallways at one particular time. So I think that's important to know. And again, and again, and again, please make sure if your children do not feel well in the morning, please do not put them on the bus. As I said, our buses will be disinfected nightly and wiped down in between runs. We are going also, as I said earlier, social emotional wellness is important for all of us. We're working with our guidance teams, our clinical teams, and our buildings to make sure that we take into account to our staffs and our students' social emotional well-being, and we put a multi-tiered level of supports to ensure that we're connected with our kids, be emotionally aware of where everybody's out at, and provide skills for students to deal with the stresses of school looking very differently when Mr. Trombley talks about it. Classrooms will have a reduction about half in the size, but kids will be at individual desks, spaced out, wearing masks, obviously with mask breaks when needed, but that's going to look very different, and that can feel very uncertain to students. So we need to make sure that our staff are connected to our kids are connected to our staff, and that our clinical team is connected to each other. And that'll be important as we open. I'll slide by school schedules because Mr. Trombley will really go in specifically how school will look and how it will work. He will talk more about the expectations for student attendance, both during in-person and remote instruction. What I will talk about is connectivity is really important. We had been a 5 through 12 one-to-one school where kids were provided a device that they used, that in our 4th and 3rd grade classrooms, there was a classroom cart for every classroom. And, there was some shared devices, about a half a cart K through 2. With the closure last year, we became a one-to-one school K through 12. In doing so, now we're refreshing to a new year. We have new kindergartners coming in. Our 4th grade parents got a message that we need their Chromebooks, and we're going to give them newer ones because we need the current Chromebooks for the kindergartners, and we're going to have new students entering. So it's important that everybody has a device prior to the beginning of school, and that you have good broadband service at your home. And if you don't, please, 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 please contact us through that help desk button that I showed you on our site. Let us know. We're here to help you. We're here to help you get connected. If you have issues in any way, shape, or form, we will get you connected. It is really critically important that we do that. Mr. Trombley, I said we'll talk about teaching and learning. We'll talk about special education when we talk about teaching and learning, as well as second language learners. And again, as we said, Ms. Legato and her team in human resources will be making sure that we're staffing our classrooms as much as possible. We're providing supports as much as possible, and that we're also supporting our staff if there are issues, health and safety issues. We're supporting them as well. To give you now where this is all broken down, and I can't do every location that our student and our staff attend. What's really important is, if you see my screen, all of those considerations I talked about from a 30,000-foot view are zeroed in on at a location. So if you want to know what we're doing on school buses, you go down here to considerations and actions by locale, and it'll tell you our mitigation strategies and the details of how we do those mitigation strategies. If you want to know about our nurse's office, if you want to know about our department offices. The other thing that I need to just let everybody know, there are going to be no visitors to school. That is part of our mitigation strategy. We are doing our meetings remotely. If you're a parent and a kid forgot their lunch, call the building. We'll meet you outside. We'll grab the lunch from you. We'll do things like that. But there are going to, at this point, given some of the assurances we had to give to New York State and some of the mitigation processes, we're not going to have visitors in our building. Our meetings will be done remotely through telephone or through video conference. So that is just to keep you safe as a community member. It's to keep our kids safe and our staff safe as well. So I'm going to stop sharing at this point. Mr. Trombley will talk a lot more about the teaching and learning process. And then at the end, we'll have some time for some questions and answers.
Thank you, Dr. Stoll. Just a housekeeping item before I start talking about the teaching and learning aspect of our reopening plan. We are trying our best to make sure that we are admitting everyone quickly. We have a function within Zoom, if you're familiar with it, called Admit All. There is an individual with a username that is inappropriate trying to gain access, so we cannot admit all, or else we would allow that to be seen by our Zoom, and we don't want that. So we have to admit people one by one in certain cases. So if you have friends or neighbors who are saying they can't get in, we're going to get to everybody. We just want to make sure we keep the meeting with the appropriate decorum that we want to expect as an educational institution. So that's why there may be a little bit slower admitting process today. So I'm going to share my screen right now to dive into, and Dr. Stoll will let me know if my screen can be seen by the group. I want to bring you to the very bottom of the teaching of the reopening mitigation plan, which has the safety and mitigation considerations, which allows the teaching and learning process to function within that framework. If you click on that link, you will be taken to our thinking about how we will conduct teaching and learning. We wanted to make this, as Dr. Stoll said, the reopening and mitigation plan is 66 pages. This is a fairly large document as well. We wanted to make it easy for you to get to the place that you needed to get to. So all of the table of contents are bookmarked. So if you want to see what we'll go to right now, our instructional schedules, you simply click on that and you will be brought to that page in the document. So I'm going to share with you, we'll go through each grade band, such as elementary, middle, and high school. I want to talk to you about our instructional schedules. If we are given the authority, we proposed 3 instructional schedules. The first was full in-person learning. That's utilized when we are given approval from the Department of Health or New York State Education Department or Governor's Office or other regulatory agency to return to school as you would imagine a school should be, with kids and teachers in classrooms safely learning and engaged in the learning process. As Dr. Stoll said, because we must follow CDC guidelines at this particular time and the footprint of our physical plant does not allow for all students, we're looking at reducing density as a mitigation approach of our student population through what's termed a hybrid learning model. That is when we are, for health and safety measures, trying to reduce the density in our building. It allows for some students to be in-person learning from their teachers, other students to be learning remotely, connected to the classroom through a live stream or a camera when appropriate. And then the other learning plan that we have in our planning is a fully remote or distance learning. This will be implemented if the district is mandated to cease in-person learning, and all students will connect to our learning program remotely, similar to what we may have seen in the fall. So we'll talk about the elementary hybrid learning plan right now because as of today, we anticipate starting our school year in the hybrid schedule. This emphasizes our teachers interacting with the students both in person and remotely and in real time. To do this, the majority of students will be clustered into 2 cohorts of students in honor of our school colors, the blue cohort and the gold cohort. To help you understand what that means, your child will be assigned to one of those cohorts. If they are assigned to blue, on those blue designated days, blue students will be on-site present learning in school for instruction, and the gold cohort of students will be learning remotely. When you see a gold day indicated, just the opposite will occur. Our gold cohort students will be in-person learning from their teacher in the classroom, and the blue cohorted students will be learning remotely. So here's a way that you can help understand this. The day of the week, the cohort color is assigned to a day of the week. And we structured it so that in a 2-week time span, we had an equal amount of instructional opportunities, in-person instructional opportunities for all children. In a similar manner, if you look at the high school, the middle school, it's the same approach with the cohorted students. Blue days are designated the days that the blue cohort of students, once identified, and I'll talk about that process in a second, they will be in school learning in person from their teacher, while the gold students connect remotely to the classroom. On gold designated students in the gold cohort will be in person, and the blue cohorted students will be learning remotely and connecting remotely to the classroom. A question was brought up in last night's town hall that I wanted to provide some more. In the middle school, utilize an ABCD day, and that is the learning schedule for the student. So do I have math first period? Do I have study hall second period? Do I have English third period? That is designated by the letter for the middle school day. The cohort is still aligned to the day of the week. So you can see here that on the first week rotation, and we're going to be putting together a calendar that will have every day laid out with what cohort is in on which particular day. Know that in the first week rotation, Monday, Tuesday, and Wednesday are all blue students on site with gold students learning remotely. If it's a blue day, if it's a blue cohort and it's schedule B, this blue cohort students will be in class. All students will follow the B day schedule for their particular classes throughout the day. In a similar manner, the high school follows an A-B schedule. The same cohort schedule will be applied, and your A and B day designation will dictate the actual classes that you attend in that day. At the cohort will follow on the day of the week. So if there's a holiday, there's a question about a holiday. If a holiday occurs on a Monday and we return to school on a Tuesday, as you can see, it would still be a blue. It would be a blue cohort day. At the secondary level, the class day of the week, either the A, B, or ABC designation, that when you have a holiday, the days continue. So you would return to school on whatever day that particular day is once you return from the holiday for your daily class schedule. And again, like I said, we're going to be putting together a calendar that will show everybody those specific movements. We have some students that will be coming in full-time to learn. I'll let Dr. Stoll talk about some high-need students with disabilities that receive extensive services. Before I do that, I will talk about there will be some of our most at-risk English language learners to where we have the greatest extent possible. They'll be provided daily in-person instruction within the classroom. Those specific notifications to students will be communicated to families prior to our fall opening, but I'll also turn that over to Dr. Stoll to talk about some of our students with disabilities.
So yeah, thank you, Mr. Trombley. Consistent with the New York State guidance, to the greatest extent practicable, in-person services will be provided for our highest need students with disabilities who require significant and substantial special education and related services. And when we're referring to our high need students, we're really referring to those students with disabilities who require those significant and substantial special education services throughout the entire school day. And those are typically kids that are in non-integrated special class settings or special education settings throughout the entire school day. And that's really the flexibility and the taking into account flexibility in the guidance, as well as our intention to provide equity, because our highest need students who require special education services throughout the entire school day, when they're on remote learning, there's an inequity about how they access their education versus other students. So when we're talking about kids possibly having full everyday in-day services, it would be those kids that are in non-integrated special class or special education settings throughout the entire school day. And we will communicate that when we communicate, at the same time we communicate the blue or gold cohorts.
Thank you, Dr. Stoll. Going to the teaching and learning environment, I wanted to touch base on some expectations of students. We heard some feedback from our spring distance learning plan that your interactions with our teachers are vital, and a desire to have more interaction with our teachers and have connection to that classroom. We have structured that so that is a key component of our hybrid and any remote learning plan as well. However, we know that student attendance and participation in our learning plan is key as well. So we do have the expectation that whether you are in a blue or a gold cohort, whether you're in-person learning or in-person remotely, when you are healthy and able to attend class, you will attend class to the greatest extent possible. So our attendance policy and procedures will be in effect. If we are in a hybrid opening, elementary teachers will take attendance twice daily, once after the Pledge of Allegiance and the second after a return to lunch. We consider a student who is learning remotely in attendance if they are logged in and actively participating in the learning plan for the day. At the secondary, we take period by period attendance. It will be taken within the first 5 minutes of the start of the class. And again, students will be considered present if they are logged in and engaged in the teacher's given learning plan for that day. We know that some extenuating circumstances may come up in terms of, particularly in the remote learning environment. So communication with your child's teacher and building are key if those circumstances come up. With respect to cohort considerations, so if we must implement a hybrid learning schedule, students must attend their given cohort plan for that day. So if it is a blue day, blue students must come to school, and gold students must learn remotely. If a student comes to school, if I am a gold student and I come into school on a blue day, for safety purposes, we must contact them immediately and have you come pick up your, because we are doing this to reduce the density, and our principals and our schedulers are taking a painstaking amount of time to make sure that we have numbers that can accommodate social distancing within our classrooms. So if that does occur, we will be contacting the household to have them come pick up their student immediately to make sure that we can maintain those parameters. Now, we also understand that if you are a student who is unable to attend in-person or remote learning due to an illness, the process is that parents should contact the school's attendance office to inform them of that absence. If you are a student who is attending, who is supposed to attend in-person learning, but you do not feel well enough, or you fail, or you respond on the daily health screening positive, so that you should not be attending school, but you feel well enough to attend remote learning, please follow the same protocol to contact the school attendance office and then log into the remote learning aspect of that. Now, if there is any questions about any, as I said before, extenuating circumstances, please have a discussion with your teacher or your building principal. The other thing I want to talk about too is I mentioned before, this is a new paradigm to our teaching and learning environment, to our classroom. We are connecting students while they are on their non-in-person day through a remote stream when appropriate. And what I mean by that is we anticipate that when the teacher is providing whole group instruction, when they're providing whole group feedback, when they're interacting with the remote students, maybe in small group work, when they are sharing something for the whole class to be aware of, when they are providing instructions, when they are bringing the class together at the start of class, where they're closing the lesson, the camera will be on, connecting the students through the stream to the classroom. We have to ensure the privacy of our students in the classroom, and also the respect of the teaching and learning environment for the teachers that are conducting this this new paradigm of teaching and learning. So please note that according to our code of conduct, which will dictate behavior, even in the remote learning aspect of this, that recording, modification, or distribution of video and still images of teachers or students is not permitted. So that must be made apparent, and it must be adhered to. Now, continuing with that, the fact that we are looking at school in a new way because of this health crisis. We know that this requires a Herculean effort by our teachers to make a transition, because most of our teachers have never been trained to teach in this environment. Most of our students have never been taught to learn in this environment. So it's going to take some adjustment, and we're going to get through this together. We know that one of the key components of that is supporting our teachers. So we will be creating professional learning opportunities for teachers, specifically before the start of the student attendance, students on site coming back to school, centered around a couple different themes. We're going to put together some training opportunities where our teachers become familiar with our safety protocols and how they can best instruct our students in those protocols, such as healthy hygiene practices, safe respiratory practices. How do we move through our buildings now? How do we enter into the classroom in a safe way? How do we make sure that we keep social distance? We also will provide training for our teachers on supporting staff and student social emotional wellness. We want to make sure we help our teachers understand how they can engage students with content in these various learning environments, such as our in-person, our hybrid, and our remote learning, and how we can connect our cohort students to the classroom as well too. So again, just like Dr. Stoll said, I've done a lot of talking, and we want to make sure that we allow some time for any questions that are associated with what we've just presented. So at this time, I will turn it over to, excuse me for 1 second, just having a little delay in my computer. At this time, I will turn it over to, we'll open it up to community questions. And the way that we're going to approach community questions is, if you look under your participant tab, you should have the ability to raise your hand. And Dr. Stoll and I will see that hands are raised, and we'll call on you by your username, and we'll ask you to please unmute yourself and state your question. And we'll answer the question to the best of our ability, or we'll ask one of our other assistant superintendents to come in. So under the participant category, you have, if you click on that, you will have the ability to raise your hand, and we will recognize you and then allow you to answer your question. So the first hand raised that I have is Michelle Evangelista. Please feel free to unmute yourself, and we look forward to your question.
Yes, so this is her husband, Tom. The question is, if a child in the classroom comes down with a fever and they're brought to the nurse's office, pending, are they required, number one, to get a test? If so, is the rest of the class required to isolate during that unknown time period if that child has been diagnosed?
Thank you for your question. I think it's a really good one, and one that probably many parents have. So let me take you from the first part of the question of what happens. And look, it's a school. Kids get fevers, right? It doesn't necessarily mean it's COVID. However, our procedures are a little bit different since COVID is in our country. So the first thing they do is they go down to the nurse's office, and the nurse conducts a health screening, takes the temperature, talks about the symptoms, puts them in another room, not just in the nurse's office, where they'll be monitored, when we'll contact the parents. We will tell you as a parent what, these are the symptoms, and we'll give you information to go see your pediatrician or direct you where to go. At that point, HIPAA laws take into effect. If your child goes and gets, we can't broadcast who is diagnosed with COVID-19. That's against HIPAA laws. But what is supposed to happen is that if you do go get a test from your healthcare provider or from a testing site and an individual, whether the Department of Health is notified, and then they start to do contact tracing. We will be notified that a kid, somebody has it. They're not necessarily going to tell us who, but they will ask us where, probably where this person was, and then they will determine who needs to self-isolate. We will work with the Department of Health, and they will tell us who may need to self-isolate, and they will be in contact with those people as well. So we were going to coordinate that response with the Department of Health. And again, there's confidentialities here. So if a staff member or a child in a school district is diagnosed with COVID, we cannot broadcast who it is, the name of the person, who the person is, or anything that would give away their identity. So that's kind of how this would work. Just because a kid has a fever and goes down and is sent home, you're not required to then self-isolate the class or we can't notify parents in the class that a kid went home with a sore throat or fever. I hope that answers your question.
It does. Thank you very much.
Thank you for your question. Next in our queue is Jennifer Marino. Please feel free to unmute yourself, and we look forward to your question. Jennifer Marino.
Hi. Yep. Hi, can you hear me?
Yes, ma'am.
Okay, thanks so much. So I just have a question about testing and how you're going to be partnering with the Department of Health. Because I listened to the governor also, and I mean, my understanding, I guess, from what he said, or at least what it sounded like he said to me, was that there should be some sort of asymptomatic surveillance in schools for both staff and students. And so it looks like that's not what's going to happen. And I know you can't mandate testing, but I'm just wondering what that protocol is going to look like. Is it only going to look like, kids who are then sent to their doctors, and then the doctors are recommending testing, getting tested? Is that what's going to happen?
Sure. So Jennifer, thank you for the question. It starts it starts before school, where every student will be asked to complete the health screening before they come to school. And if any of those indications or symptoms are indicated, students should stay home. As we've talked about, we as a school district do not have the capability to conduct testing. So that's why we rely on the community testing resources, such as those may be available through our community health partners or individual medical services providers. But we do not have the ability as a school district to conduct the testing that you're referencing.
And to just add more to that, Jennifer, the governor said we need to have practices, testing practices, and our practice will be, and the guidance that kind of fills in the language of the governor came down, and working with the Department of Health, is our practice is we need to know where testing sites are. So if we're concerned, our nursing staff is concerned, they may have a conversation with the parent and say, look, you may want to talk to your physician about getting testing, or if you're concerned, here's where you can get testing. So that information will be provided, but we are not required to conduct testing, nor are we allowed to tell a parent, you need to get testing or you're not allowed back in school. That is not something we can do. We can give people the medical information and resources, and then what we do is we follow, when any confirmed cases, we follow the Department of Health's guidance and communicate what we can to who we can.
Okay, I understand. And the same is for staff members?
Same applies for staff members, correct.
Okay, thank you.
Thank you, Jennifer. Next in our with their hand raised is Kim Shurak. Please feel free to unmute yourself, and we look forward to your question, Kim.
Hi, good afternoon, everyone. Thanks again for taking this opportunity to meet with all of us. I know it's a question that's probably on everybody's mind, since it was a question last night and it was mentioned quite a bit, was sanitation between classes at the high school level. A comment was made in regards to that there will be no sanitation of the desks, but in the plan, it states that high surface areas will be cleaned daily. But
yes, so
in between classes, you're talking about one student in the class, 9 students share that one, across 9 periods, you're talking at least 81 children in that one desk.
So Kim, great question. Yes, we do plan on daily sanitizing the classrooms. Where we are not able to clean in between classrooms, the mitigation strategy that we have in place is reduction of density within the classrooms, also looking at all opportunities to minimize student movement through the schedule. So at our elementary, for the most part, and middle school for the most part, we will not have our students rotating through classrooms. At the secondary level, it's a little bit more, at the high school level, it's a little bit more difficult, but I know our schedulers are taking a look at every available opportunity to reduce the movement of students where we have that ability. So it again is a mitigation strategy. We do know that the sanitation process the disinfecting process that we're doing, including having logs of when the classroom was cleaned and sanitized. We are using a nightly application that, according to the manufacturer's guidelines, is when we apply the disinfectant and ionizer spray, that it causes a longer lasting effect of that disinfectant and the kill time of that too. And if Sandra Clohesi, our assistant super business for business, has anything else to add, I'll turn it over to her as well too.
What's the time?
I can't give you a set time of that, and I don't think even the manufacturer can give you a specific amount of time that it extends it for. But it does make the application of the disinfectant a little bit more effective.
Okay. I do have a few more questions. I didn't know if you were limiting to like one question or a few more.
So what we learned from last night is that we really want to get to as many people as possible. So if you wouldn't mind, Kim, asking just one question, and then we'll move on to another individual. And if we have time, we'll go ahead and go back through again. And we'll talk about, if you didn't get all of your questions answered, Dr. Stoll and I, of course, will share our contact information with you, and we'll also give you another avenue to reach out to us.
Great. Thank you so much.
You're welcome. Thank you, Kim. Next in our raising their hand is Gabrielle Dinizo. Last name is spelled D-I-N-I-Z-O. Please feel free to unmute and state your question.
Yes, hi. Can you hear me?
Yes, ma'am.
Yes, hi. And thank you for doing this. My question is, what is the process for kids that don't take the bus that are getting dropped off? Is there a process in place in terms of reducing the density in and out of the doors? Because I have 2 kids in one of the elementary schools, and they don't take the bus.
Yeah, that's a great question, and we have thought about that. So, half the student population will be in, so we're hoping, though it may be a little bit increased because some parents may want to drive instead of using the bus. We're going to have additional monitors and administrators at drop-off areas where you're going to drive up, and we will be staggering your ability to release them into the hallways. So the issue is we're not grouping kids. So drop off, please bear with us. Drop off may take a little bit longer. We're not going to have kids coming into the building. In the past, we've had, in the elementary, kids come in the building and wait for the doors to open for the classrooms when the teachers get there, or in the middle school. You're going to have to wait until we have sufficient staff in our buildings so that we can monitor the hallways. The other thing that we're doing is looking at where our and the buildings will communicate if any changes to this, looking at multiple entryways for our drop-off for our buses, as well as a separate entryway for the drop-off for our parents to reduce the density. The other things is that at the secondaries, we're not using lockers, so kids are not going to go to their lockers and congregating. If the elementaries are going to, and your buildings will tell you specific, they're not going directly to the lockers. They're going directly to the classroom, sitting in their seat. So this will, again, reduce the likelihood of density in our hallway. So that's, one of the techniques, a mitigation technique that we're trying to implement with parent drop-off.
Okay, thank you. And I'm sorry, you had mentioned snow days. Are there not going to be any snow days anymore? Like, is everyone just going to be remote when it snows, or?
Inclement weather closures, there's no changes in regulation in terms of inclement weather or closures other than COVID-19 closures. So every other process, like when we had power outages this week, if we had students, it would be everybody's off because people are dealing with an emergency, right? We close schools when there is typically a weather or another type of emergency that has impacted our ability to do our normal operating functions.
Thank you.
To follow up on what Dr. Stoll said, many aspects of our school day are a delicately timed orchestra of movement, and we know that that movement is designed by our principals and with input from staff, and so these things take practice to get right. So to just be aware of that, our first day is probably going to look our second day is going to look different from our first day because we're going to learn from things. Our fourth day will look different from our second day because we're going to learn even more. To help accommodate that and to help ease into some of these new processes and protocols that need to be vetted and reviewed and adapted, we will be changing the first couple of days of what school will look like. So in Mr. DiCarlo's July 31st update to the community, you'll note that on September 8th, we will have a superintendent's conference day. We'll be working with teachers on what those protocols might look like. How can we support students? How can we start to reimagine this new classroom? On September 9th, that will be a half day where the blue cohort is on site learning in person. Gold cohort is at home learning remotely. It'll be a half day for students. The second half of that day, we anticipate reflecting on our processes and what went well and what didn't go so well and what can we learn from. And then on September 10th, that will be a half day for students again, with the gold cohort being on site learning in person, with blue students learning remotely. And again, a half day for us to reflect upon what has happened. Looking forward to the 14th, September 11th will be a remote learning day for all students. And then we'll welcome back students starting with our cohort schedule on the 14th for full days of instruction. So I know that I took away from some question time. I'm going through the chat here. Next in the question queue is username T Boyd. Username first initial T, last name Boyd. Please feel free to state your question and unmute yourself.
Hi, how are you? Thank you so much for taking the time to answer these questions. My question has to do with the remote aspect of the 2 days in, 3 days remote, 3 days in, 2 days remote. How is that going to look? Is that the teacher is teaching and the kids are sitting and listening at home to that teacher? And if so, what happens to the working parent that can't monitor that all the time? Like how do we adjust for those measures?
So we understand that childcare is a major concern with any aspect of remote learning, and we put together a schedule that balanced the need to have a mitigation strategy of reducing our students in school, having some students in school. That the only other option for us to do was to reduce our density to have some students learn remotely. But you are correct, students will connect via their district provided Chromebook to a teacher in the classroom. They're going to follow their normal schedule that they would for each day, and they would connect from their Chromebook to their classroom through a stream where a teacher may, during certain times of the day, such as large group instruction, giving directions, bringing students together to debrief on an activity or to reflect on an activity or answer questions, where they will be connected to the classroom. We do know that there is the burden of childcare at home. That was definitely part of our considerations as we look to this plan, and it unfortunately is a byproduct of having to have a reduction in density of our students.
Right. So that, which is understandable 100%. So then, is it right to assume that learning will continue fluidly throughout the week? Only sometimes my child will be in the building, and sometimes they'll be sitting at the table at home listening to the teacher who is teaching the class. Like my confusion is this: is on the days that my kid is home and the other cohort is in, is my child listening to the teacher teach the other cohort and participating from home in that regard, or is it like a separate piece?
No, it would still be if your son or daughter is assigned to Mr. Trombley's 8th grade social studies class, and it occurs at 10 o'clock during the day. Your son or daughter would connect to my class, and I would be giving a lesson to the students in front of me and also at home. How that is structured, we're going to work with teachers on various options on what that might look like. They will have some flexibility there, but to maintain the continuity of learning of both cohorts, they will be the teacher will be instructing the students who are learning remotely at the same time they're instructing the students in front of them.
Okay, so that's how we're managing the number of children in the building, and then how we're keeping a continuous flow in the curriculum to help our child and the teachers stay on track.
Correct, and we're working with teachers that some teachers may feel comfortable taking different approaches to how that might look. Okay. But yes, you are correct. It is to keep the continuity of instruction for both cohorts.
Okay, thank you very much for answering my question.
You're welcome. Thank you. Next in the queue is username Lisa. Lisa, please feel free to lower your hand and state your question.
Yes, I have a, thank you for doing this first off. And I have a question with regard to the younger students and their specials. My son is coming in kindergarten, so I'm an anxious mother. And I am wondering about what's the policy for gym class? How are they keeping the social distancing? How are they keeping, especially the young children, from getting too close? Okay, because I've had my son going, he's been in a preschool, he's gone to camp, and kids are they love each other. So how are we monitoring this?
So Lisa, you're hitting on one of the most painful things as an educator we have to deal with right now. Most of us got into this profession for our joy of interacting with children and helping children learn to their fullest potential. And we have to approach how we interact with children differently, all the way from our classroom to the gyms to the music recitals. We have to maintain physical distancing guidelines first and foremost. So wherever possible, and this can also be found in our mitigation plan on page 47 under gyms. We're putting in together physical distancing of students. We extended cleaning and disinfecting procedures. Our gym classes have a physical education classes have a additional mandate that it's not just fixed 6 feet apart. We keep students 12 feet apart. So we're looking to get it outdoor as much as possible when weather permits. We're looking at students work in spaces and utilize activities that are not team sports or contact sports, reducing the use of shared equipment, rethinking what types of activities can we implement in physical education, such as aerobic activity, wellness activities, healthy choices, those types of approaches there.
Okay, and regarding the younger ages, as far as the teachers in the classroom, keeping them with it. So, I mean, I know it's difficult. I'm a teacher myself, so I'm just asking at that age group, you know, how it's different.
Yeah.
So go ahead, Dr. Stoll.
I was just going to say, you know, Lisa, I appreciate being an educator yourself, that you know, especially the young ones that come in, they're excited, they want to touch, they want to explore, they want to learn. That's how they learn. We're going to have to do a lot of work with our students on lessons about social distancing. And I, you know, I'm a parent myself. It's been quite some time since they've been a kindergartner, but they're in middle school now. And some of the things of practicing wearing masks and things like that, getting appropriate mask breaks. But also we're going to have locations, you know, personal space. We used to talk about personal space, right? Like I was a former elementary teacher. Personal space and not going into personal space. But now we're talking about social distancing or physical distancing. We're going to have to teach kids like this is your space, this is your desk. We're not sharing equipment. School's going to look very different. And you know, we hope to get over this hump and go back to what we know how to do well, and our staff knows how to do extremely well, is teaching and learning. So there's going to be a lot of learning. This is a mitigation strategy. We cannot prevent a kindergartner from, you know, getting excited and coming up and touching another kid like that. I'm not going to promise things that we can't, but those are the kinds of times where we are going to teach our kids about how to keep each other safe. So our nurses are working, we'll be working with our staff on lessons about proper mask hygiene, about proper hand washing hygiene, about how proper social distancing hygiene. We're going to start to do some work with our students and our staff on how we teach, especially the younger ones, how we teach them how to do these things safely. So it's a teaching and a learning process.
Mr. DiCarlo is working with our buildings and our video production crews to put together videos of what a day for each student might look like at each building and on buses. So those should be coming out, or if some aren't already are out, there should be some more coming online. So those also might be good things to view with your children as well too. And having the conversations at home. I know my two sons who are 8 and 10, when they asked to do something, they're using vocabulary I never thought and phrases I never thought an 8-year-old or 10-year-old would know, such as, well, we can't do that because we have to stay 6 feet apart. So those types of things are all part of the new lexicon for our students in this event. Lisa, did we address your question? Okay.
Yes, very well, actually. Thank you. I appreciate it. Fantastic.
Thank you, Lisa. Next in our question queue is Bridget Silberto. Bridget, please feel free to unmute yourself, and we look forward to your question.
Hi, can you hear me?
Yes, we can, Bridget.
Okay, thank you for this opportunity. My question is, if faculty and or students have a medical exemption from masks, are they permitted on campus?
Yeah, yes.
They are. They're permitted in the mix with
Yes.
everybody.
Yes.
Yes.
Okay.
The process is, staff has their own process to go to Deb Legato and Human Resources. Mr. Tremblay's office will be sending out a survey. In there, it talks about if your child has a medical condition that you should to let us know, and that you should send medical documentation to your building principal, who will share it with the school nurse and will review it. We will take other measures depending on it may be additional PPE or other types of PPE. It's an individual decision about some other strategies we may be able to use. But yes, we cannot exclude, it's in the guidance, we cannot exclude anybody who has a medical condition that precludes them from wearing a mask.
All right, thank you very much.
So, and again, we talked about using the word mitigation. We still will have mitigation strategies such as social distancing in effect and applicable to that too. So that aspect is still there. Next in our question queue is username Stojanowski, Stojanovski. Please feel free to unmute yourself, and we look forward to your question.
Hi, can you hear me?
Yes, we can.
Oh, hi, thank you so much. I heard you speak to how gym was going to be in elementary school. I was just curious. I have a daughter going into 6th grade, and I know in the middle school they have to actually go in the locker room and change their clothing. How is that going to be handled? Are we not going to change?
Great question. Yeah, we are going to ask that if your son or daughter has a gym on their schedule for that A, B, C, or D day, and they are on site with their cohort, that they do come dressed ready for gym to reduce any congregation in locker rooms. In fact, we're looking at closing down the locker rooms entirely in certain locations.
Thank you so much. I appreciate that.
You're welcome. Next, raising their hand is username Melissa. Melissa, please feel free to unmute yourself, and we look forward to your question.
Hi, thank you. I'm jumping to the high school, and my biggest concern is the time in between classes. I know that we've all seen the pictures from Georgia, and I know that the high school, even at half capacity, those halls tend to be full. Mm-hmm. What are we doing?
So, Melissa, thank you for that question. It also highlights some of the work that our building staff are doing and the fantastic work that they're doing, to the attention to detail, to all the considerations we need to look at the high school. Just as in all buildings, we're conducting walkthroughs with principals, custodial staff, and we're looking at various things that we need to consider. The high school does have wide enough hallways, and they are looking to separate that hallway with visual aids to make sure that the direction of moving in one way goes in that continued ways. We look at mitigation strategies such as, can we direct flow of traffic maybe up one stairway and down the other, so that we're trying to mitigate as much interaction as possible.
And to add to that, where we can, where there's not a safety risk, there in some buildings, we may be able to do one-way hallways if there's another way to get back to where you needed to go. So we've looked at each building. I think we have Fulmer Road still to do, but you're going to the high school, definitely signage about stairwells, directions in the hallways, one or the other way with signage, kids wearing masks, and with the reduction of density. We believe that what you saw in that picture, with kids going in multiple directions clustered together. And again, it goes back to even what I said about the kindergarten. We got to even instruct our high schoolers that when you're in the hallway, stay on your side, stay as far as you can from other kids walking in the hallways. And again, we hope that by educating each other, educating our kids, and marking things out in a correct way, we can mitigate what you may have seen in a picture.
And again, it's another one of those protocols that's practiced and learned as you practice it. I now, where I first started going to the grocery store and I went down the wrong aisle 7 times on a trip, I now only do it once, and I only get yelled at once. So it's in a similar way, we'll work with our students on that as well.
Have you given any consideration to releasing classes at different times? So
we did.
Yeah.
We did. The problem is that if we release X amount of classes at different time, there's going to be an equity instructional time about the last release. So we actually thought about it, maybe a staggered release of some kind. But if you have that many classes, if you have 800 kids in probably 50 or 60 different classes being released in 30-second increments, I mean, you're talking about missing potentially a half a period of instruction. So we thought about it. We really, really thought about like 30-second releases. We're still thinking about small little things we can do. This is why we're having the half days. Even if we can release a classroom like row 1, wait a second, row 2, wait a second. Like we got to test we're getting into minutia here, and it's not minutia, it's important. The building principals, Matt and his team, are looking at little things they can do that won't impact instruction. So there's a real delicate balance here about providing quality instruction as well as keeping, our mitigation strategies intact.
Great, thank you.
Thank you, Melissa. Next with her hand raised is Michelle Mokelbus. Please feel free to unmute yourself and ask your question.
Hi, can you hear me?
Yes, we can, Michelle.
Okay, my question is actually from my son. He's a senior this year, and he's waiting on the parking permit approval. And it's kind of a 2-part question. He was wondering, will everybody, since it's half the class in on any given day, will everybody probably have a parking spot? And then the second part is, say he opts in first quarter, but we have to opt out second quarter because of whatever reason. What happens to his parking spot?
I'm Michelle, great questions. I'm going to do that Jeopardy thing and ask to take the second part first. When you refer to opting in, are you talking about opting into our fully online?
Coming into school, doing the hybrid in person and not person.
So, as part of that questionnaire that Dr. Stoll mentioned, where you can request a mask exemption, and I'll go into that in a little bit more detail too. One of those questions will be, would you like to opt into fully remote learning for the start of the school year? And yes, because of the complexity of how this schedule is being built and formulating our cohorts. Once a decision is made to opt into fully remote learning for the school for the start of school, at the secondary level, you will only be allowed to opt back into the hybrid model, where you would come on in person some days after the first quarter for the start of the second quarter, and then at the elementary school, it'll be for the first trimester. You'll do it for the whole trimester. Now, if we are told for whatever reason by Department of Health, New York State Ed Department, the governor's office, or another regulatory agency that has authority that we are going back in person, and that's the mandate, then of course you wouldn't be in that full remote learning. In terms of parking, this was a topic of conversation at our walkthrough. Greg, did we have a final decision on the parking permits, or should I reach out to Mr. Ziegelhofer about that?
It's a great question. I think it's one that we just don't. I personally, I think Mike doesn't have an answer to. I think that's about your parking. Will your senior get a parking spot? And if they opt into remote learning and decide to second quarter opt back into the hybrid model, I think it's a better question for Dr. Lawrence and his team. I don't know that I have that specificity, but it's really a really thoughtful question.
Okay, thank you.
Thank you, Michelle. Next in our queue is Nikki's iPhone. Nikki, feel free to unmute yourself and ask your question. And it's Nikki with an Nikki, in case there's another. Nikki, are you able to unmute and ask your question? Okay, Nikki, we'll try to get back to you if you're trying to connect. We'll go to Tommy Spin. Please feel free to unmute yourself and ask your question.
Hi, good afternoon. Thank you for everything you're doing, first of all. Question about the three different ways that school would open. Of course, we're not going full, and we're doing the hybrid. And a couple of questions. So if the state decides to go full, do you still have the option of opting out? And the other question is, a lot of social media, I see a lot of people that are saying that they're going to opt out completely and just stay home and be schooled. Is there a certain percentage where if that hits a certain level, you're just going to say, there's not enough people coming in, we're just going to opt everybody out?
Yeah, so good questions. That are the overarching answer is that we have to follow what we're mandated to do from the regulatory agencies, such as the governor's office and state ed. So if we are told that students must attend full in-person school, we as a local education authority who are governed by the New York State Education Department regulations would have to make that assurance that school students are coming in person. In a similar manner, if we were told by Governor Cuomo that we must reopen schools and to the greatest extent possible have students in, the reason why we're going with the hybrid is because we want our students in school, but we have to do so within given safety regulations. So we at this point in time, we're not considering a certain threshold of not opening schools that we've discussed a particular percentage.
Just to add to that, if the governor's officer said everybody's coming in, there would have to be additional guidance about how we do that, and we'd have to communicate that with our community, our staff, and our families. So, that would require additional guidance and possibly an amendment to our plan.
So with the plan with the hybrid right now, if enough people are opting out, because you do have the option to opt out, will that ever get to a point where you're going to say, it's not worth bringing anybody in because there's only 5 kids in each class because everybody's opting out? Or is it always going to be hybrid?
As of right now, unless data changes, we make our decisions based upon data. We don't have any data that suggests that even if every classroom had 5, that we still wouldn't do instruction. And we just don't know what that is. Our plan for opening schools is the hybrid model.
Okay.
Data, if there's any changes in any of the plans, there's going to be a lot of planning and a lot of communication that have to happen. So, it's a great hypothetical, but I don't know that I want to give an answer because we would need to do a lot of communication and a lot of planning to make those kinds of things happen.
Okay, thank you.
Thank you, Tommy. Just want to do a quick time check to make sure that we can get to some of our additional information before we end this town hall for the day. And again, if you are still waiting to have your question asked, we're going to have time for about 2 more questions. And then we're going to go to the next part of our town hall to make sure that we can respect your time, but we'll also give you other avenues of how you can have your questions answered. So next in our chat is Kimberly Catalano. Please feel free to unmute yourself and ask your question.
Hi, can you hear me?
Yes, we can, Kimberly.
Okay. I actually have 2 questions, but I think my most pressing one is for support services like OT, speech, PT, that sort of thing. Will you be pushing into the classrooms, or will the students be pulled out and taken to like the shared space that they typically use?
So great question, Kimberly. And one of the things is we have been, as we did our building walks, we have been looking at the locations that our providers do provide services, OT, PT, speech, AIS, reading intervention, things of that nature. And if the spaces are too small to hold a group, we are finding larger spaces where those kids can be provided with their instruction. Now, there may be cases where kids are on remote, where it makes sense to do that remotely when they're at home. It's really an individual basis. But from a mitigation standpoint, some of the spaces our providers have are too small to hold group. So we're working with our building principals and our custodians to find alternative locations where kids can be distanced, right? And that can provide that instruction in a larger location.
Okay, that's actually great. That definitely answers my question. My other one's a quick one. Have you guys considered using like mass non-contact temperature assessment devices, like when the kids are coming into the schools or staff, or is that just not plausible?
So I will tell you this, our hope is that we have 100% compliance with our health screening. However, we know that that may not always be the case. And then we may have to do health screenings for kids who may be in the beginning of the day. So we do have non-contact infrared thermometers that we have purchased for the district. So we do have those available.
Okay. All right. Thank you.
You're muted, Mike.
Oh, thank you very much. That answered my question.
And then we also did consider various types of screening opportunities, such as screening all students before we came in, but we didn't want the impact on instruction or the congregation that would occur and the density that would occur at those screening locations. So they were considered. Last question for this session will be for Mike Caruso. Mike, please feel free to unmute yourself.
Can you hear me?
Yes, Mike.
All right. Good afternoon. I'm
Good
a
afternoon.
member of transportation, so with no surprise, my question has to do with transportation. I noticed that with the cohort split, that we had 2 full days for the blue schedule and 2 full days for the gold, and it seemed that Wednesday would be split between the 2. Did I understand that correctly?
Correct. So if you go on a 2-week rotating schedule, that first week you have the blue cohort in on Monday, Tuesday, and Wednesday on site, and then Thursday and Friday the gold cohort students would be coming in, and then on the second week your Monday and Tuesday blue cohorts would attend in person, and then Wednesday, Thursday, Friday gold cohort would be on site.
So are there days when blue and gold both come in? one in the morning and one afternoon?
No.
Oh, all right. That's
No,
how it looked on the schedule there.
No.
If you look to the far left column of that table, it will show you the different weeks.
All right, excellent. Thank you.
Thank you, Mike.
Thank you, Mike.
So at this time, I'm going to go ahead and share my screen. And again, if we didn't get to your questions, we'll talk about what are some other avenues that you can have your questions answered, because we want to make sure that that we do provide that opportunity. So I wanted to share with you our next steps. And Dr. Stoll will let me know if my screen is being shared.
You can see it, Mr. Trombley.
Great. Thank you, Dr. Stoll. And these are not all inclusive. We know that with the dynamic nature of this health emergency, as information changes, as research changes, as guidance changes, as our response to that guidance changes, we must continue first and foremost to always put the safety of our staff and students at the forefront of every decision. Immediately after this town hall, I will be sending out, it'll come from School Messenger. So you'll receive it. I'm going to send it through the snow chain. So I know I was the guy who during the tropical storm, you may have heard my voice waking you up early in the morning. We felt it was important to share that information. And just in the same manner, I will be sending out through our snow chain contacts this family reopening questionnaire. I'm going to send it out as quickly as I can after this. And in there, that will contain the opportunities for you to request 100% remote learning for your child. You'll have the opportunity to request a mask exemption for review from our health-related personnel. You'll indicate your preference of transportation and food service. And we just want to look to see how many of you are looking to either take part in district transportation or drop your children off on their own. And then also, how many of you are interested in saying that you'd like to utilize or not utilize our food service program? The transportation and food service program, those are non-binding. They're just your best thinking as you know right now. The request for 100% learning, once that is submitted, that will be what you are doing for the secondary, for the first quarter, and for the elementary for the first trimester. If you do not fill out a form for a child or answer that question, by default, your child will be placed into the hybrid cohort configuration and assigned a cohort. You will need to fill out one form per every child in your household that is attending Mahopac in the fall. Let me repeat that. You'll receive the form once, possibly 2 to 3 times if you have different contacts listed with us. However, you must fill out a separate form for each individual child in the fall. Repeat that again because of how important it is. Must fill out that form that you're going to be receiving called the Mahopac Central School District Family Reopening Questionnaire for every child in your household that will be attending Mahopac. Additionally, our next steps, we will and we anticipate being able to announce our cohort assignments by the middle of next week, especially once we know the numbers of individuals if they're looking to opt out. And I have to say this to everybody in the column, please let your neighbors know. Due to the complexity of scheduling in general, particularly this year, we cannot entertain cohort requests. Please know that we know that many of us have extenuating circumstances we'd like to consider to pair up with another family. Our first priority was to make sure that if individuals households have siblings, that those siblings within the household are considered to be in the cohort. For perhaps schedule childcare on certain days as possible, but we cannot entertain any cohort within a particular cohort with another child or another household. I apologize. It's just the nature of the scheduling, the complexity of scheduling that we are dealing with. We will continue to build the daily course schedule, particularly at the secondary level, and we'll communicate specific student schedules and placements for classes in late August as we approach our opening of schools. We will be posting our remote learning plan separately so that you can access it easy should we need to go to that remote learning approach, but also we do hyperlink every table of contents within our plans. We will be posting a detailed approach of our testing and tracing procedure, but just as a reminder, as a school district, we do not have the ability to test. We rely on community and local testing resources. And we will enlist the help of the Department of Health and follow their processes and guidance in terms of any contact tracing. Dr. Stoll is taking synthesizing all of the questions that were being asked into an FAQ, and we hope to have that available later next week or the following week. We will be sending out a home language preference survey to individuals who may have multiple language spoken in their home. And as always, we will listen, communicate, adjust, adapt as needed. And we look forward to doing that and doing this as a community, as your neighbors. Now, if you are not able to have your questions answered, Dr. Stoll took you to our district reopening website. At the very bottom of that, if you click on the tab that says submit a reopening question or concern, you can ask your question there. Dr. Stoll and I also shared with you our email addresses as the individual COVID-19 district safety officer and district COVID-19 resource officer. We know that there are many questions out there because of how important this decision is, and we want to make sure that we're available to answer the questions that you have. And so I will say again to the community, thank you for taking time to join us. We know that this is an ever-evolving situation, and we appreciate you partnering with us as we look to do this in the safest and most effective way possible. So be on the lookout for that family reopening questionnaire. And again, you have to submit one questionnaire for every child that will be attending Mahopac in the fall. And so at this time, I'm going to end the meeting. I don't want to be rude. It will just kick you out automatically. But I wanted to say thank you again for your attendance, and I'll be ending the meeting at this time. Take care, everyone. Be healthy.
Thank you.